Hello and welcome everyone to the League of Women Voters of Moscow's 2023 Spring Speaker Forum. We are recording today's presentation. We are a nonpartisan organization, and this series is a way for us to inform people in our community and our state about important issues. For our Zoom meeting today, we would like everyone to remain muted, but you will have an opportunity to participate by clicking on the word chat at the bottom of your screen. Type your questions or comments at the bottom of the chat box and hit enter to send to our speaker your questions, and those will get answered at the end of the presentation. In recognition of April being National Child Abuse Prevention Month, our program today is called Child Abuse Prevention Looking Upstream. However, before the presentation, I'd like to introduce Rhonda Allinger, who will present a bit of history about how the League's work has intersected with that of our main speaker, who she will then introduce. So Rhonda, it's all yours.
Thank you. I'm excited to share with you the background regarding how a study done years ago by the League of Women Voters in Moscow led us to having our speaker today. I've enjoyed seeing this process move from a local level study to having a position recognized by the State League, the development of the Braces Committee, collaboration with other entities in the state with similar goals, and the passage of a legislative joint resolution, and ongoing work with the Idaho Behavioral Health Council. I'm going to share my screen. Everybody can see that okay? Okay, from 2017 to 2019, the League of Women Voters of Moscow conducted a study on ACEs, or Adverse Childhood Experiences. Susan Zinnier and I worked with many League members and were co-chairs of this undertaking. If you're unfamiliar with this study or the position statement, you can find information regarding studies on League of Women Voters Moscow website. And also there's not that study, but there's more information about ACEs and the Braces Committee. I think Kathy will show you a link at the end. So the position, the League of Women Voters Moscow recognizes that there's growing scientific evidence that correlates high incidence of adverse childhood experiences with health and social problems throughout the lifespan. And given the complexity of the ACEs issue and rapidly emerging science, we believed our local organizations and professionals needed additional help bringing ACEs training and responsive programs to Latah County. Additionally, we believed that legislation and the support for education regarding ACEs would be beneficial at a state level. And so after a little detour through a global pandemic, in 2021, the Braces Committee was formed. The Braces Committee goals provide information about the need for and current research on better integration of physical and behavioral health care, including ACEs-informed interventions, to all leagues in the state to inform them of the importance of this issue. And then secondarily, coordinate with League of Women Voters Idaho Board to inform Idaho legislators about the need for improved interventions, education, and care, advocate for the Idaho legislature to pass ACEs-informed legislation that supports effective interventions and care. Co-chairs, Kathy Dawes and Ann Cheadle, worked with the League of Women Voters of Idaho Board of Directors towards this goal of passing a joint legislative resolution. They contacted local Senator David Nelson about this goal. He worked with other legislators, League of Women Voter Idaho, and many other allied supporters, including our speaker today, to educate others about the need for this resolution. And after a lot of hard work, in February 2022, the joint resolution passed. But Braces did not stop there. Committee members then became involved with giving feedback to the Idaho Behavioral Health Council as they were developing strategic plan of action. The Idaho Behavioral Health Council was developed with representation from all three branches of state government, as well as community partners, and was tasked with developing and implementing strategic plan in 5 main areas designed to improve Idaho's access to behavioral health resources, and provide better outcomes to those who need services. It's their vision that adults, children, youth, and their families who live with mental illness and addiction receive behavioral health care services they need when they need them. Throughout the development of the relationship with the Idaho Behavioral Health Council, Kathy and I were asked to participate in the Youth Protective Factors and Resilience Implementation Team to implement the goal referred to as Recovery Number 5, since it aligns most closely with the League's previous work on ACEs. The purpose of this team is to identify and enhance protective factors that promote long-term well-being in youth and their families, which can mitigate negative life outcomes. This effort will strengthen families and communities through resiliency promoting practices. We work to identify targeted resources to educate stakeholders in order to effectively partner in a statewide system of support. This slide shows a sample of some of the projects the team has been working on. Statewide youth assessment centers, statewide youth crisis centers, school resource officer trauma-informed training, school-based professional learning for behavioral health and wellness, trauma-informed training for school professionals, parent trainings, ACEs and resilience assessments, targeted education and awareness training for medical professionals, statewide parent book club for the book What Happened to You, and an iPad project for law enforcement officers to be able to connect when out in the field when they identify mental health needs. This team is also where I've come to know Roger Sherman. I appreciate his energy and optimism, and I'm happy to introduce him as our speaker today. Roger is the executive director of the Idaho Children's Trust Fund, which is also the state affiliate for the Prevent Child Abuse America. Under Roger's leadership, the Trust has greatly expanded its efforts to prevent child sexual abuse, introduced new ways of preventing shaken baby syndrome, and engaged educators, physicians, and others around trauma-informed care, ACEs, resilience, and strengthening families. He's worked with schools and other organizations statewide, both in his current roles and previously as community organizer from 1979 to 2007. Roger was named Child Advocate of the Year in 2017 as a recipient of the Jerry Hirschfield Special Achievement Award for the Idaho chapter of American Academy of Pediatrics. He serves on the board of the Idaho Resilience Project, Children's Trust Fund, and the Boise's Farmers Market. Roger, thank you for being here today.
Thanks, Rhonda. And thank you for the opportunity to be here today. I appreciate it. So the Idaho Children's Trust Fund, just to give you some quick background, was formed in 1985 by the state legislature. And although we don't receive any money from them, we are a checkoff on the state income tax. And, so if that's coming up for you, we'd appreciate any donations you might move our direction. The Prevent Child Abuse America, of which we're also the affiliate, was formed in 1972 and is the oldest organization whose primary focus is on prevention of child abuse and neglect before it occurs. So being at the upstream piece of that. I just wanted to, my mom's birthday would have been this week, and so my mom was a very dedicated League member, so I just wanted to honor her in this as we move forward here. And she was very active in the League for decades. I can remember her typing. She was a newsletter editor for in different places where we lived, and so it was kind of her big thing. So anyway. She would have been 95 this week, so yeah. This is this April, and as Kathy mentioned, it's National Child Abuse Prevention Month, and this year's theme is prevention in partnership. And the focus of the idea behind prevention in partnership is that we really wanted to highlight the importance of working together. This is the national theme, but here in Idaho, we could not do any of this work if it weren't in collaboration and coalition with a whole bunch of different organizations working statewide to support and prevent child abuse and neglect. Since our work is around both, we provide funding, training, provide technical assistance, support a network of community organizations around the state. Our real feet on the ground are groups that are working, in communities, as I like to say, from Sandpoint to Salmon, and from Kamiah to Du Bois, which are just towns I pick out of the hat to some extent, although that Salmon to, or Sandpoint to Salmon is nice alliteration, right? And that's the big fish hook, around the state. So the idea really is that no one group can do this, can prevent child abuse and neglect. No group can be, can be the only group working to strengthen families. That work is really all of our community's work, your work, our work, and the work of parents and so on throughout the state. So really, it is prevention and partnership. I wanted to start by talking a little bit about just our orientation towards the concept of prevention, because sometimes that word, I think, doesn't necessarily resonate the way that it does for us, but just want to give you tell a little story. So, what does prevention mean to us? And this is something that's called the parable of the river. So in a small town, a group of fishermen gathered down at the river. Not long after they got there, a child came floating down the rapids calling for help. One of the group on the shore quickly dived in and pulled the child out. But minutes later, another child came and another, and then more children were coming down the river. Soon everyone was diving in and dragging children to the shore and jumping back in to save as many as they could. In the midst of all this frenzy, though, one of the group was seen walking away. Her colleagues were irate. How could she leave when there were so many children to save? After long hours, to everyone's relief, the flow of children stopped and the group could finally catch their breath. At that moment, their colleague came back. They turned on her and angrily shouted, "How could you walk off when we needed everyone here to save the children?" She replied, "Well, it occurred to me that someone ought to go upstream and find out why so many kids were falling into the river. What I found is that the old wooden bridge had several planks missing, and when some children tried to jump over the gap, they couldn't make it, and they fell through into the river. So I got someone to fix the bridge." Hey, imagine that. Whoop, what just happened? Sorry, something just happened. Oy, oy, oy. Let's see, let's get rid of that. Okay, sorry.
Well, you got it. Good.
You got me back? Okay. I don't know what happened there. I must have hit something. So then this is what we call primary prevention, because primary prevention is really prevention of things that, so they don't happen in the first place. And so what might that mean in regard to prevention of child abuse and neglect? So the Centers for Disease Control and Prevention has created this, they have looked at strategies for preventing child abuse and neglect before it occurs. And some of these are large policy ideas as well. So they kind of fit into the way I think sometimes the league is thinking about your work. Some of them are more just really how we as a community might work together, and others are really specific kinds of pieces of work. And so the first one they say is create an environment that supports parents and positive parenting. I think, as some people really feel like really get shamed, for things that really they ought not to, and people struggle with parenting and actually recognizing that there might be somebody out there who they could ask for help. Second is enhancing parenting skills to promote healthy child development. Now that's kind of a more specific thing that might fall in the area of some of the things that Rhonda described in that list of activities by the Behavioral Health Council, which fit into things we also do, which are funding programs around home visiting, providing parenting skills, developing parent support groups, and so on, and all of those kinds of things. Something that might not be as clear, sometimes is strengthening economic supports for families. And that really is, what the recognition is that families that are feeling unstable because they don't have, enough, economic wherewithal, struggle, because, there's often that puts a lot of stress on families, and then their ability then to really work with their kids and so on becomes, they become overwhelmed by the problems that they're facing with, maybe being unemployed, there not being sufficient community supports. I mean, we might see some of that as we see some of the lack of funding for things like childcare, some state funding for childcare, some of the state funding for, or the national funding for SNAP benefits or food stamps, and those changes are going to have some effect on people's, sense of well-being and their stability. Ensuring a strong start for children. It's really a big focus on early childhood education, developmentally appropriate childcare, preschool programs, et cetera. And then, finally, to intervene to lessen harms when something has started to occur, or there is some risk of something happening. So some of the ways that the Children's Trust Fund is helping to fix the bridge is by providing funding, training, public education, convening people, and developing community capacity. So we work with a variety of different things. This says last year we provided about $200,000 in grants to groups around the state, some of which were to really provide concrete supports. Other things were to provide parenting support and other kinds of programming. We're working with the Idaho Community Schools Coalition to develop and spread the idea of community schools that have the capacity to support families that are basically are school-based family resource centers, and so are providing some behavioral health programs, some physical health programs, food, clothing. Some have washers and dryers, so the community schools start to be a program that helps to support, since they are really neighborhood based, that they're in a position to be able to provide, community support and family support. And that's a way to provide services in a non-stigmatized sort of a manner. And so we're really interested in things that start to get us to a place where people will seek help, because we know it's a big problem among the human species, maybe, and certainly among Americans and Idahoans, not to ask for help when they need it. And, we think it's really important that we create opportunities for people to ask for help, so that, as people are stressed out, and every parent, I think at some point or another, is going to be stressed out. This is not an easy job. So how are the children, and so how are the families, because all of us do need help sometimes. So one of the ways we can measure the health of our communities is through looking at adverse childhood experiences. And I think for most of you, probably familiar with most of this, since the Braces Committee has been so active. But the adverse childhood experiences study, the ACEs study, was done in the late 1990s in a group of 18,000 Kaiser Permanente patients, and they, out of their study, reduced it to these 10 adverse experiences that seem to be most prevalent. So abuse, neglect, and household family dysfunction are challenges. And abuse would come in the form of physical, emotional, or sexual abuse. Neglect is physical and emotional, and household dysfunction in these several areas: mental health, the mental health of a parent, incarcerated relative, the mother particularly being treated violently, substance abuse, and divorce. And those ones were identified in what's now seen as sort of the classic ACE study. This next slide will show kind of how it sort of progressed in some ways to thinking about it in a broader term. And so these are what this comes out of George Washington University, came up with this idea of a pair of ACEs. And what they're suggesting is that adverse community environments are really the root causes of ACEs, and not so much that the cause of the ACEs is all of the things that, the abuse, neglect, and family dysfunction, which are the things that we identify, but that often those things are products of the kinds of community conditions that people live in, right? So that may mean poverty, discrimination, various types of community disruption, through natural disasters or other things that might occur, violence in the community, poor housing quality and affordability, and then generally just a lack of opportunity that people feel, and that often those adverse community environments have led to these to the adverse childhood experiences that many people have. And the roots of that are, obviously this is not a simple thing, just, it's a pretty complex problem, but, overall that, that these are the kinds of things that underlie, the ability of families to feel the kind of stability that they are, whoops. That was me. All right. And so then next I'm going to talk a little bit about ACEs in Idaho. In Idaho in 2018 and in 2020, the state measured through the Behavioral Risk Factor Surveillance Survey, measured now about, I think, 7,000 to 8,000 Idahoans on whether they have experienced any of, again, the traditional ACEs. And so the studies in 2018 and 2020 were almost similar within 1 or 2 points. So they're very, very close. There wasn't really a significant change, even though there's a significant larger sample size. But what it told us was this, that nearly 2/3 of Idaho adults have experienced at least one adverse childhood experience, and nearly 1 in 4 have experienced 4 or more of those adverse childhood experiences. And what we know about people who've experienced 4 or more is that they're more likely to have long-term physical, long-term physical and long-term behavioral health issues in their lives. We like to say from the beginning that ACEs are not fate, they're not destiny. They are only events that occur in your life, and they can be mitigated by other things that occur in your life. So you don't necessarily have all of the health effects or all the behavioral health effects. I don't want to make it less serious, but I also want us to recognize that an experience is an experience, and experiences can be buffered by the impacts of the kind of work that Rhonda and others do in the communities. So this breaks it down a little further. This breaks down the Idaho ACEs a little further, and ACEs are measured, in case you don't know, retrospectively. So that they're asked of adults, before the age of 18, were you forced to have sex, made to touch someone else sexually, etc. All of those things that are listed here. And as you look at this, it's as children, 1 in 8 Idahoans were sexually abused, 1 in 6 were physically abused, 1 in 6 witnessed intimate partner violence between their parents. 1 in 4 lived with an alcoholic, and fully 1 in 3 experienced what they would describe as emotional abuse. So all of those things are, what as Idahoans, this tells us what the population of Idaho generally is experiencing. And what we know about that is that our numbers are higher than the average of the other states who have done the behavioral risk factor survey. So we are on the upper range of people who experience 4 or more, and those people who've experienced experienced at least 1 ACE. And then we know this, that ACEs significantly impact school performance, and you can kind of look at this. These are called the population attributable fraction. This is a statistical analysis to look at what percentage of all of these various things are impacted by ACEs. And you can see how learning disabilities are significantly impacted. Almost more than almost 2/3 of learning disability is impacted by ACEs. Now, these are correlations, they're not necessarily completely causational. And I know in this community, I probably need to be careful with all of that, like trying to mess around with that science stuff, but I'm going to give it a shot anyway. And then you can just see as you look through this what the impact is of ACEs on measures of school performance and school, what impacts kids as they are entering the school systems. And so it's a very significant portion of that. And so what we know also is that by dealing with those, by mitigating the impacts of ACEs, we can change that trajectory. And that's what the importance of knowing about it is. So then enters HCR 29, and Rhonda mentioned it, and I just kind of pulled out the therefore sections rather than the whereas sections, which were quite long. but the therefore section is primarily that we work with state agencies around the state so that they would become more informed regarding the impacts of ACEs, and that they implement evidence-based interventions and practices. And so that is these things this resolution was delivered to all those organizations and to a variety of nonprofits around the state. And so that is kind of how it was disseminated. And then Kathy had asked me if, to sort of point out some places where state agencies were actually taking this on. And so that's what I have next. So the Idaho Department of Health and Welfare has, as part of its strategic plan, a significant portion dealing with ACEs, and there are committees that I'm a part of right now too to put these into place. And so the first one is that by July 2025, they want to implement 3 evidence-informed initiatives that reduce harmful adverse childhood experiences in Idaho families. And that by implementing programs to support families, we can have a long-lasting positive impact on the health, safety, and independence of Idahoans. So there's a group made up with some of the public health people, the child welfare people. I'm not inside the agency, but I was invited to join that group. So, so I'm part of the thinking on this, mostly because of the next objective, which was a funded project that the Idaho Children's Trust Fund and the Idaho Resilience Project took on to implement a learning collaborative with medical providers to increase screening for ACEs, to interrupt the intergenerational transmission of ACEs within families. And I'm going to give you kind of a rundown of that piece of work. And then I also wanted to mention that the Department of Health and Welfare also has a data group, which is taking the ACEs study from 2018 and 2020 and are working on shaping, trying to help make the data useful to the program people. Because sometimes I think what happens is you got a bunch of numbers, cool. You got a bunch of people doing work out there, cool, and they never connect. And so the hope is that through this collaboration that they can kind of create a way for the data to become meaningful to the people who are both evaluating and developing programs. So the goal of this project, as we went into it, was to increase the use of positive and adverse childhood experience screening in medical practices, and primarily pediatric practices, to improve parenting and health outcomes through longitudinal support, meaning that we want this to extend over a period of time. So some of it comes out of really how the American Academy of Pediatrics has been thinking about a lot of this work, which is that, this is what they've said, having safe, stable, nurturing relationships is a universal biological imperative for children to fulfill their potential, to be healthy and resilient, to be successful academically, economically, and socially, and most importantly, to become the caregivers that value and build positive relationships with subsequent generations. That last clause being the one that focuses on parenting. And, that's our, so that is a lot of what we are trying to focus on, is how this relationship with physicians can be, can lead towards positive interactions, with kids. And so that kids have the most opportunity to thrive. So we went into this ACE Learning Collaborative. We started with a series of focus groups. We wanted to develop a parent-centered approach to this problem. Approach to how physicians might approach screening. Because something that has always been vexing is that you have physicians who probably would want to do screening, but worry that that parents wouldn't want to participate, and that they would be, so they get a lot of anxiety around doing it, and as a result don't do it. And so our approach was, and we did this over a period of about 8 or 9 months, did a series of focus groups. And this is what they came up with, the list on the right. And, some of it was really what I think what it comes down to a large extent is we want a relationship with our physician. We want to be treated respectfully. We want to be sure that, if you're going to screen for something, that you do something with it. And we want there to be resources, when we're done. And so we knew from the beginning that's kind of how we wanted to design the program overall, was to meet those needs. So this was in phase 1 of the project. We really focused pretty much completely on how to, how could we make a parent-centered, a people-centered, human-centered kind of a design, so that it would focus on what people want and need, and that would, people. There were a lot of the parents who kind of went, we think if we tell you something, you're going to report us to CPS. If you're going to do something, we're gonna, we don't want to get involved in this. And so part of it, so we had to think about, well, how do we help doctors, figure out how to make sure that people don't feel like that that's not going to be what happens, because it's not really what your ACE. This was to screen for parental ACEs, not. So this would be what you had experienced in your past, not what was experienced by your children at this moment, which is the only time CPS could get involved in that situation. And then I always bring in this quote, which I always think is really great, that I believe parents want a better life for their children, and that's what we heard on and on and on. We'd be willing to do this if we can understand that this is going to be a benefit to our kids. So these are some of the things that parents said. I'll just give you a sec to read it. Just kind of, and this came up a lot. The one that I have in the red is that when doctors ask questions, I don't always give the best answer because I feel like I'm being judged. And what we learned is that in terms of really getting reliable answers, if there's a relationship, if there's sense that, you're going to use this to the benefit of the family, we're willing to do it, and you're going to get an honest answer. If we think this is just being done perfunctorily, I'm not going to tell you about my childhood trauma. That is not going to be, that there's no good reason for me to do it. And then the docs, kind of had their own things, but they learned, they were learning as we went through this, that learning about how trauma could impact a patient or a parent, and how they could impact those parents. Dr. Patterson, who's also sits with Kathy, Rhonda, and I on the Behavioral Health Council subcommittee, he always says, he took it from someone else, but he always says it, that asking is a powerful form of doing, and with the idea that really it's not, people don't so much need behavioral health services as they often just need a listening ear, a support person. And we've talked about this quite a bit on the Behavioral Health Council. Is how do we, because we recognize that we probably don't have adequate number of professionals to deal with all the issues that all the people who maybe could benefit from counseling, but often it's not going to happen because there just isn't enough people to do it. And so how do other people play that listening ear, become that listening ear? Other group I wanted to bring up, in addition to the ones I was talking about with it, I'm talking about Department of Health and Welfare, and actually Rhonda kind of brought it up as well, is that the Idaho Department of Juvenile Corrections and the Behavioral Health Council really have adopted this whole idea that it matters what has happened to you. And that's the fundamental kind of idea behind the behind how we need to understand ACEs. That ACEs that we need to move from a paradigm that suggests that something's wrong with people to one that suggests that we understand that something that or what's happened to people is really what's important, and that should guide our responses. But I wanted to just lift up, a couple of things that Idaho Behavioral Health Council and the Idaho Department of Juvenile Corrections has really focused on building these assessment centers, and they really have had an amazing over really about 10 years or more of really reducing the number of juveniles in detention. I mean, it's less than 100 kids statewide, and that used to be many hundreds, who were in juvenile detention. That's not to say that kids don't get in trouble, but the way in which when kids get in trouble, we're dealing with them is quite different than it was in the past. And so that, I think, is also a response to this whole movement around, ACEs, protective factors, and positive childhood experiences, and thinking about how we lift up those positive experiences. And then I always say, but here's the thing, we want to focus a lot on resilience, and resilience is the ability to cope when things go wrong. Resilience, it doesn't, I don't think resilience mostly exists. It kind of has to be built, and so it's built when children, often because people face difficult situations, and then there's somebody there to help buffer those situations, help them work through it. There's been over the last several years, there's been some effort to recognize what are specific positive childhood experiences and how we can build those. And these are the ones that have been measured. There's certainly other things, but a lot of this has to do with trying to understand. This came out of I guess what they say, giant literature review of all the materials that dealt with what kinds of experiences help to build resiliency and help to promote good mental health in adults. And so these several things are what are being measured, and what actually in the assessment tools that we're using with the docs, we assess both on ACEs and on these positive childhood experiences. And some of these, like I always look at this one, the feeling of belonging in high school, when you know that so many kids don't feel like that, is like, how do you develop a school system that actually promotes things that kids will participate in and that they want to be part of, and that you think about that, intentionally, so that everybody who doesn't like football and isn't necessarily in sports or even in band or whatever, but might need the skateboarding club and the I don't know, whatever, different things that that kids might be involved in that are different from maybe the traditional things. And I've had great conversations with teachers around this stuff too. This is what we talk about when we talk about, so this is the other side of the tree. This is the tree of community resilience. This one is the one that looks at sort of the same kind of conceptual things as the ACEs tree that I showed you earlier, but really focuses on what are the positive experiences in a community. How do we provide those equitable and trauma-informed systems and supports, so that you look at this as both a policy frame and then as individual activity from people. So what can we do starting now? So you can take a look at this list. These are the things that these are most of the things that were listed in the in the CDC's report, and then these are some of the things that come underneath those. This one adds some of the issues that surround domestic violence a little more than the first list I showed you. This one is actually a list of activities that can be done to mitigate the impacts of ACEs broadly. And that's my pitchy pitch, but so yeah, so I've kind of I do a whole lot of things fairly quickly. But again, all of these are the kinds of things that, promote positive parenting, positive childhood experiences. We like to look at prevention as, creating the kinds of environments and relationships where, families can develop in a healthy way. And so that is really our, is really the way in which we focus our work, working towards the things that we want to achieve versus working against the things that we want to stop, if that makes sense. And prevention is, works that way. If we're talking about, as the title of this thing, it's the title of this talk is, is going upstream. It's because, there are so many things that we're doing, unfortunately, I think at the end when we don't prevent, when we're not working upstream and we're working, working instead to catch the kids in the river and not to fix the bridge. And so the whole idea behind this is how do we work towards fixing the bridge? And I know the League is multidimensional in that way, thinking about both community efforts and policy and policy change. So I'm open to any questions you might have for a few minutes, I think.
Thank you so much, Roger. Let's see, I don't see anything in the chat, but we have a small enough group. If you would like to either raise your hand, let's see, Roger, if you could stop sharing your slides and then we can see the whole group. If somebody would like to ask a question, you can either raise your hand, raising it like that, or going down to the reactions place on the bottom of your screen, and there's a hand raising symbol if you'd like to ask a question or make a comment. Nancy.
Mm-hmm. Thanks for your presentation, Roger. Could you mute yours, please? Sorry, Gary and I can you hear me now?
Yes.
Yeah.
Oh, yeah.
Gary and I are on a common speaker here. Roger, thank you for your presentation this afternoon. I'm wondering if your organization has done any work with public infrastructure that facilitates interaction among community members and access by children. I'm thinking about work that has been done on physical activity and parks and bicycle pedestrian pathways and community gathering spaces in central parts of neighborhoods and towns. So what infrastructure can facilitate this sort of healthful interaction that you were describing?
Yeah, I think in our world, other than probably the work we've done with schools, I wouldn't say that has been a place. It's certainly something we support in the public health community through some of the work that's called Get Healthy Idaho. Is doing some of those both community assessments and then working towards building capacity, but it's like community by community. So I know like in the community of Mountain Home, they have a project of Get Healthy Idaho, and they're looking at exactly what you just said, those kind of healthful activity, or, how does the built environment work towards, improving the lives of families? And I certainly am in favor of it. It's not something I'd say we have been particularly at the center of, other than, like I say, in the infrastructure of building community schools and looking at those as hubs for community engagement and for positive parent interaction and family interaction. So I'm I definitely think it's a part of the thing, and I think when you look at that resiliency tree that I put out at the end, that really does focus on that idea that that the things that happen in our environment, the conditions under which people live, have huge effect on whether or not they have the inner strength sometimes to deal with everything coming at them, so that child abuse and neglect are less likely to occur.
Roger, we have a question in the chat. With the Idaho Department of Health and Welfare stretched thin, How are they doing with the three goals of providing projects, providing training, and screening? Do they have a specific budget line for these goals?
Very good question. Very good question. You're right. They are stretched thin. Although most of what we've heard about really is in the child welfare division and not so much in the areas where I see a lot more work going on, which is in the public health arena. And they seem to have sort of their, kind of the people that they have needed. I don't think well, I know they don't see as much turnover as you do in the, in the child welfare divisions. Partially because they're working on the upside, trying to improve conditions and not really finding themselves always at the end of dealing with the, with the trauma that we don't prevent. The project that I was talking about with the pediatricians was funded through, as most of the health and welfare related stuff is federally funded, and so there is a lot of federal funding, or has been a fair amount of federal funding for a lot of this work. We were funded through a grant from the Maternal and Child Health Division, which is also in the public health arena. But it's not what you said is right. I don't know that there's really as specific budget items to, to put these into place, but as part of like their planning process is to create the opportunities for that to occur. So I don't know. I think you're, as you, obviously, Henry Ann, you know that there's so many of these, the state does not fund well in a lot of these areas, and they haven't really put nearly the emphasis on prevention that we would have liked. The governor had in his budget a $2 million item that would have come through the trust fund to fund some parent support related, family support related kinds of activities, and it got axed very quickly. So and then everybody sort of turned their attention, which me too, towards making sure that the childcare money actually got, because that was, the 2 million would have been great, but it would have been bonus money. The childcare money had to happen, and if you had to trade something off, even though we would have been the beneficiaries of the $2 million. I was certainly supportive of putting, as much, that the emphasis needed to be on getting that childcare money out to the communities. So, so this is why you all need to keep doing the work you're doing along with us in partnership, because, because they need to understand that if they put more money into prevention, more money into upstream solutions, we would see benefit from that, and we would over time see reductions in the problems and promotion of the, these really positive aspects that, make our state a good place to live. But, we're gonna, but, our current legislature is not super prone to move in that direction. How about that? We'll just
and along those lines, I'd like everybody to know that through the, when that budget was being discussed, the child care budget, the Braces Committee met, and we drafted a letter that was approved by the State League president, and we sent it to all the members of the JFAC committee to urge them to get that money. So I just wanted to let you know we did take some political action there on behalf of that funding. So are there any other questions? I have one. I noticed on your last slide that one of the things that was listed as a goal, I think, was social emotional learning. And I know that that's a buzzword right now that brings up all kinds of, things from both sides of the aisle. And I wanted to know if there's evidence, if there is evidence showing that social emotional learning in schools is helping.
I'd say at this, well, there have been a ton of studies done in relationship to that kids are not ready to learn I don't have numbers, so that's why I was a little hesitant. But there's a ton of literature showing that, in terms of, the kids coming into school, with trauma, with just even minor traumas coming into school and being, having anxiety, not really being able to, to settle, causes, disruptions in the classroom. And that those teachers who are using various kinds of grounding techniques and various kinds of things to help kids sort of settle in and deal with their social emotional learning or social emotional competency, get benefit from that in the classroom. That a lot of the behavioral things that they might be bringing from home or from the bus or from the hall, get settled out before you start doing the instruction. And in those situations, then those kids feel like they can, then kids can learn. You don't come into the classroom with two different brains. There's not one brain that you leave out here and that's all, worked up, and another brain that's ready to learn. I mean, being ready to learn involves those two things coming together, so that you're, and certainly from teachers who do this work, boy, they tell great stories about the impacts of that. So in addition to what I know are like a lot of literature on the subject and research, is also that, the anecdotal evidence, from teachers who practice it.
Great.
So
Thank you.
I will tell you one story though, just quick, that, we talk about that as a buzzword, but one of the biggest projects that's working at that in Sherman, Idaho, there's a group called the Mahoney House, and that group is doing social emotional learning with all the kids throughout the whole Sherman school district. And they actually call it social emotional learning. Check that out.
I will check that out.
Yeah, no,
Thank you.
they're doing great work in that area, and they're talking about it too. I was like, man, it's like we're funding some of that work. So I'm like, you go.
That's great. I'm going to have to stop now, but thank you so much, Roger, because we have another thing that we're going to present today, and that is a tremendous opportunity to tell you about. Another Braces Committee member, Ginny Foote, who is here, will tell you about her very generous offer to provide free trauma-informed training for anyone who wants to learn more about ACEs. So Ginny, I'd like you to tell us all about it.
Thank you, Kathy. Thank you very much, Roger. That was a wonderful presentation, and it makes my little talk much easier too, because you went over everything. I appreciate that. So in the class is called Trauma Informed Course 1. It's created by Community Resilience Initiative based in Walla Walla, Washington. They're one of the first community resiliency areas to actually create models for community resilience in addition to individual resilience. But the course goes over what we call the near sciences, which is our neurosciences. So we learn about how our brains work, and there's a lot of new science out about that. It's pretty amazing stuff. And then our epigenetics, which we also have a lot of new information about. We know our DNA is stuck, but we have epigenetics, and that is a real good blessing for us to be able to tweak with and to stop some things like historical trauma. We do have the ability to change those things, which is wonderful news. And then of course, we'll learn about the ACEs. If you are already familiar, it'll bring up some other things, but you do learn about the ACEs and the other ACEs that are besides those 10. There's many more that have been discussed since the 10. And then of course we end with resilience in the near sciences. Then we will go into strategies, which are how we do exactly what Roger was saying. You want to move from seeing people with what's wrong with you to what happened to you, and looking at everyone that we work with and live with, as well as ourselves, with positive intent, focusing on responding instead of reacting, and different things about that. His example of, don't wait till the bodies are coming down, go upstream. That's all part of these strategies to be able to help us to live better ourselves and to help our communities to live better. And then we're going to learn to use a trauma-informed lens to be able to work with these strategies and to go on from that. The trainings are going to be, there's a 6-hour training, and I'm going to offer it on April 25th, 26th, and 27th at 2 time frames. So people who can do it at work, it'll be from 2:30 to 4:30 p.m. And for those who are unable to do it at work, I'm going to do it again from 6 o'clock to 8 o'clock p.m. I'm going to be joined by Lauren Nichols. She's a licensed master's of social work and is a professor at LCSC. And so together we'll be going through this, and I hope that you'll spread the word. And if you can join, please join us and bring friends with you. And it is free. I'm with the LC Valley Resilience Coalition, and we'll be putting the registration on our website. It's not there yet, but we'll be getting it there. It's lcvrc.org will be where the registration will be for you to be able to sign up for it. And also our LCVRC is part of Hope Harbor, Idaho, which we received a grant funded by the Idaho Resilience Coalition Project, the Idaho Resilience Project. And we have just been doing so many great things with the money that we were able to receive from that grant, family kits, and we're working with lots of different communities throughout Region 2 of Idaho. So I just wanted to mention that that's how we're doing so much work out in the community, and it's a lot of fun. The other thing is, real quick, I just want to mention, thank you again, Roger, the public health. This is something that needs to be just like seatbelts and smoking. You know, we've got to get it out to where everybody knows about it, everybody understands about it, and, you know, they'll make their choices. People do. But that's the kind of push that this has to be, is just like those community public safety issues. Thank you.
Thank you, Jenny. I mean, this is an incredible opportunity that we need to spread to organizations around the state, and we're going to be doing that. I put the link or the address then for you to go to that website once it's up. Just keep checking it, but we'll also be sending out a league notification to all league members about it as well. I do have to say, there is a question that someone, Roger wrote a note. We call this Friday Wear Blue Day in celebration of Child Abuse Prevention Month. So wear blue and send a picture. So Roger, they would send it where?
Oh, good point. I'll put an email in there just for that.
Yeah, that would be great. And we'll send that out to everyone as well. There was another question that someone asked. Let's see. Nancy made a comment. Some sources of distress for children include gender identity, racial disparities, climate change, and other controversial topics that are under fire by the Idaho legislature. If kids can share these concerns in school, are Medicaid paid counseling sessions for low-income households still able to do so in the privacy of behavioral health professionals' offices? Roger, do you have an answer to that one?
Well, I will just say that, most of, unfortunately, I mean, a lot of the Medicaid paid counseling, is so overstressed, it takes months to get to see anybody. And I don't know, Rhonda or somebody else might have a better handle on that, but I just know that's a big problem, having an opportunity. I like us to think about things like community, like some of the community resilience model and other things that might really help to support a more lay workforce, or not even workforce, but
Right.
like people who are become more trauma informed and can have these conversations with kids. I am really worried about, some of the things that just happened with the transgender bill and all of that, that there's going to be kids that are going to be feeling that pretty heavy today and for a while.
Right.
So I share the concern and, and issues of racial disparity and, and I think kids are, also overwhelmed with climate change, in a way that I think us old folk are not so much. And, are not on. We might be, but I mean, not in the same way. I think
Mhm.
like their sense of.
And we had one more question I skipped. I'm sorry, Sharon. It was about how can we can allow children a safe place to express their trauma when therapy only occurs in group sessions and especially in rural areas, she said. And I think we don't have quite enough time to answer that unless, Roger, you have a quick answer on it. But our schools need nurses, they need professionals, and they're just not funding that. So I don't know the answer.
That's probably a good answer. And, you know, one
Yeah.
of the positive childhood experiences we talk about is the need for every kid to have a caring adult in their life. And I think that is a role that maybe all of us can play at some level or another. You know,
Yes.
it would be good to have more professionals, but, you know, I mean, but that may not be the answer in the short term anyway.
One thing was mentioned in one of our meetings was grannies on the bench, having grandmothers come to the schools and sit on a bench outside and just be there to talk with kids. I mean, there are a lot of things we can do just as community members. So our time is up, but I do want to tell you that our next speaker series program will be 2 weeks from today on Wednesday, the 19th at noon in the Arts Workshop Room in the 1912 Center in Moscow. So it will be an in-person meeting. Our speaker will be Dr. Casey Bolt, the Executive Director of Sojourners Alliance, who will speak on the topic of homelessness resources and persistent barriers in Idaho Region 2. So we hope that you'll join us again there. And thank you again, everyone, for coming today. Thank you again, Roger, Jenny, and Rhonda.
Thanks for the opportunity. Appreciate it.
Great. Thank you.